Hello and welcome everyone to this Global Investigative Journalism Network's webinar titled Investigating COVID-Related Purchases. We are very excited to have you here. My name is Deepak Tiwari and I'm the editor at the Global Investigative Journalism Network. It's great to have hundreds of journalists gathered here from all over the world for this great event. Since this webinar is organized especially for journalists of Nepal and India, we have arranged for its live interpretation. You can listen to the webinar in English or Hindi. To listen, please choose the globe icon at the bottom right-hand corner of your screen. Select English or Hindi, whichever is your preferred language. My colleague, Leonardo Alexis Peralta, is online producer of this webinar. As you know that rest of the world saw COVID and its worst impact. South Asia was no different from this. We have seen its disastrous effect. Since the outbreak of the pandemic in late 2019, billions of people have taken ill and millions have lost their lives. During the last 2 years of the pandemic, government expenditure in the health sector has increased significantly, while the bulk vaccine purchases accounted for a large proportion of the total expenditure in buying sanitation equipment, creating makeshift isolation centers, commissioning of oxygen plants, and emergency services. All these things, they saw huge spending. Transparency and accountability are a prerequisite for the spending of public money. Post-pandemic, budgetary outlays are on the rise, and the watchdog journalists around the world have an important role to play in digging into corruption and other kinds of malpractices associated with such spending. In this webinar, we bring together senior journalists who will share their experiences and discuss different ways to undertake investigative reporting in this critical area. They will share their advice on uncovering wrongdoing in the health sector and offer tips on how to find information when governments are less than transparent, or worse, when it comes to health sector related contracts and other relevant financial dealings and spendings. I'm delighted to have three great speakers today who are leading journalists and experts in their field. We have Supriya Sharma from India, Rajneesh Bhandari from Nepal, and Chrissy Giles from UK for next 1 hour to speak on this issue and answer all your questions. You can put your questions in the Q&A box, and we will try to answer. We have kept 15 minutes separate for question answer session. Among our three speakers, Supriya Sharma is senior journalist and investigative reporter. She is executive editor of scroll.in. Scroll is known for its investigative reportage in India. She has worked for NDTV and Times of India. She is recipient of India's prestigious Ramnath Goenka Award and Chameli Devi Jain Award for Outstanding Woman Journalist. She is a former fellow of the Reuters Institute for the Study of Journalism at the University of Oxford. Today, she'll be focusing on how to report on these issues using publicly available information. And this is what investigative journalism is. Investigative journalism is using information which is there in public domain. And Supriya and her team of reporters did terrific reporting on pandemic last year. Next speaker would be Rajneesh Bhandari. Rajneesh is founder and chief editor and CEO of Nepal Investigative Multimedia Journalism Network called NIMJN. NIMJN is actively collaborating GIJN Hindi in organizing this webinar. Rajneesh is an independent multimedia journalist, investigative reporter, filmmaker, and educator based in Kathmandu. His multimedia work on different issues has appeared in the New York Times, National Geographic, Al Jazeera, BBC Reel, and several other news outlets. He has worked as the multimedia editor for European Journalism Center supported news website and multimedia editor for the Journalists for Transparency investigative reporting website called j4t.org. Rajneesh will speak about his experiences in Nepal and using collaborating journalism in digging out information. Our third and last speaker is Chrissy Giles. She is global health editor at the Bureau of Investigative Journalism. Previously, she worked for Wellcome, one of the world's largest health foundations, where she was editor of the award-winning long-form publication Mosaic. She studied biochemistry at university and completed a master's in science communication at Imperial College London. Today, she is going to talk about international scenario on this issue. Her focus would be on oxygen supply contracts, pharma companies, and related issues. So this is all about our three great speakers which we have today. They are very busy journalists. We thank them that they are here. And before we go into webinar, I must tell you a little bit about GIJN. In case if you are not familiar with us, we are the largest global network in the world of non-profit investigative journalism organizations. We have 227 member groups in 88 countries. Today, with our staff based in 24 countries, GIJN works in dozen languages to link together the world's most enterprising journalists, giving them the tools, technology, and training to go after abuses of power and lack of accountability. We offer support and networking in many ways in 12 different languages, and our languages are continuously growing. Last year, GIJN Hindi, for which I am editor, this was started, and this was GIJN India was started with the objective to cater the strong presence of Hindi journalists and Hindi media. We also have GIJN in Bangla and Urdu. So friends, this is an hour-long webinar where all the speakers will speak for 10-12 minutes. First, they will have their presentations, and in case if there are any questions, I'll ask them. And during that period, if you have any question, please put it in question Q&A box. We will keep 10-15 minutes separate to get answers to your questions. So to start today's webinar, I'll invite Supriya first, then Rajneesh, and then Chrissy. So Supriya, floor is yours. Please go ahead. Welcome.
Thank you, Deepak ji, and the Global Investigative Journalism Network for getting all of us together to discuss a very important subject. The COVID pandemic has affected all our lives all over the world in a way that perhaps nothing else has, at least in our lifetimes. It's at once a global story, a national story, a local story, and I'm glad that we're all here to discuss what is a very important aspect of it, which is investigating COVID-related purchases. Now, as we know, across all our countries, a lot of public money has been spent in the name of tackling COVID, whether on equipment, oxygen, medicines, vaccines, and naturally, like a whole range of public accountability questions arise for us to take a look at as journalists, starting with something quite basic. Sorry, just if I could pull up my slides as I speak. Actually, Leonardo, if I may request you to share the slides. I'm not able to find the right share button. Sorry about this.
No problem, no problem. We journalists, we are not... there
we go. Thank you very much. If we may move to slide 2, as I was saying, there are a whole range of questions for us to ask, starting with something as basic as what is the scale of public spending? Do we know how much money is being spent at different levels of the government? Because as we know in this case, from the central government to state governments down to the local government, even village governance. At all levels, we have seen public spending. So the question for us is to look at different levels of spending and try to investigate them. Historically, in a country like India, public spending on health has been abysmal. The question is, has COVID changed that, and to what extent? No matter how much money is being spent, the main question for us as journalists is, how transparent is this spending? Have contracts been given out based on competence, or are we seeing cronyism and corruption? Related to that, how effective is public spending? Are we getting the outcomes that were intended? If, for instance, we're spending money on ventilators, are those ventilators working? Another question that's related is, are we spending on the right things? Well, even after it became clear that COVID is airborne and surface transmission is a much smaller concern, we're seeing that public money continues to be spent on sanitizers. Similarly, although we know that a lot of COVID transmission is asymptomatic, we're still spending on thermal scanners. In Delhi, for instance, where I live, you walk into a metro station and there are two people who are posted there at the entrance, one to spray your bags with sanitizers and the other to scan your temperature, which actually seems like a small instance, but points to a lot of wasted public expenditure. The flip side is, what are we not spending on? And this, I think, is an important question to ask as well, because COVID has meant a lot more work for health workers and frontline workers, often with no extra pay, which is deeply unfair. And as journalists, we should also be putting a spotlight on this. Before I go on, I'd like to add here that, when we talk about investigative journalism, often the focus is on learning new skills and techniques, and which is hugely important. But I would say the starting point should always be perspective. As investigative journalists, we need to ask ourselves, are we asking the right questions? Now I'd like to focus on two of the things that I mentioned there, transparency and effectiveness. If we may move on to the next slide, please. At Scroll.in, the news organization where I work as the executive editor, my colleagues have spent a lot of time in the past 2 years tackling these two questions, and so have other health journalists in India. I'm sharing just a few examples, which are obviously not comprehensive. The idea is just to open up ideas for the future. So right at the start of the pandemic in March 2020, when we knew very little about coronavirus, there was tremendous fear among health workers who were being asked to work under extremely risky conditions. And they began to flag a very important concern about the lack of PPE in hospitals. Now, I confess that until then, I'd never heard the term PPE, but very soon we realized how critical personal protective equipment is. And we began to dig to see what was causing the shortage. We found that the Indian government had dragged its feet over placing orders for PPE, and eventually it had done so without transparency. The first COVID case in India was detected on Jan 31st, 2020. And the next day itself, the Indian government had moved to ban the export of some kinds of PPE. But it wasn't until March 18th, which is a good month and a half later, that it held a meeting with the country's established PPE manufacturers, who realized to their shock in the meeting that the government had already placed orders, not with any one of them, but with firms that no one knew. My colleague Arifa Jory got hold of the minutes of the meeting and reported the story on these mystery orders. So did Rama Nagarajan of the Times of India. And that very day, companies began to get emails from the government, the established companies which were part of these industry associations, where they were being asked to supply PPE. So clearly, media attention on the issue forced the government to take corrective action, but a lot of time had been lost. As we know, you cannot manufacture PPE kits overnight. Over the next 2 months, we tracked every step of the process. We wrote about the hurdles, the bottlenecks, the continuing questions of over-transparency. And here I'd like to share with you the importance of using publicly available information. If you could please move on to the next slide. Well, we often think of investigative journalism as digging out facts that are hidden, but often the facts are actually publicly available, but no one has bothered looking them up. For instance, for the PPE story, we looked at the website of HLL Lifecare Limited, which is a government-owned company that was entrusted with the task of placing orders for the PPE kits. And while we looked up the website, we found that, or rather we could not find the tender documents inviting bids for these PPE kits. It's a process that is actually mandatory in all government purchases. And yet the tender documents were not there. And only when journalists raised a stink did the tender documents appear mysteriously on the site, which is what I thought actually nailed the story. Now, moving on to another example. In 2021, as everyone knows, India faced a deadly second wave of COVID. And with that came a grave oxygen crisis. Now, COVID-19 patients were dying in hospitals right here in the national capital, New Delhi, not in some far-flung remote district, because, well, there was not enough oxygen available. So once again, we used publicly available information to investigate the story. The government had claimed that it had set up new oxygen generation plants in 162 public hospitals. So we decided to pull out the list of hospitals where these plants had supposedly come up. And for this, we first found out which government agency had placed the orders. We went to its site. We pulled out the tender document. The tender document had a list of the hospitals. My colleagues, Vijayata Lalwani and Arunabh Saikia, sat and over like a day called 60 of those hospitals and found that only 11 had oxygen plants that were operational. As soon as our story was published, the health ministry was forced to acknowledge it, released data. It, as you see on your screen, it tweeted admitting that only 33 plants had been installed. Well, it didn't mention how many were functional, which was, of course, a much smaller number. If we move to the next slide. There, as you see, Central Medical Services Society. This is actually the agency that has done most of the COVID purchases on behalf of the Ministry of Health and Family Welfare, Government of India. And as you see there, the tender documents are up there. I guess a lot of good investigative work can happen by looking at these tender documents and digging deep and seeing whether the outcomes have actually been achieved. Once again, we stayed with the oxygen story. We did several follow-ups. If I may show you the next slide, you'd see one of the follow-ups found that while the country now had new oxygen plants in hospitals, we didn't have enough staff to run them. This speaks to something that I had mentioned earlier, which is that, you know, we are a country which has an abysmally low spending on healthcare, which extends to actually really low spending on healthcare workers. And it also connects the question of transparency with effectiveness. So not only were our oxygen purchases non-transparent, they were also suboptimal, something that, as we all know, had grave consequences for Indians. I'm not sure how much time we've left, but I'll quickly run through another example. Next slide, please.
You have time, please go ahead.
Great. This is about ventilators. Now, this reporting isn't based on publicly available information. It's based on information that was accessed under the Right to Information law. As you're aware, India has a law which enables citizens to petition the authorities and demand that they share information, and the authorities are actually bound to disclose it. Now, of course, oftentimes the authorities duck and you know, the query goes all the way into an appeal process, but it's still made a huge difference to the work that we can do as journalists in India. So in September 2020, Huffington Post reported that a company that had no past experience making ventilators had got government orders to the tune of 373 crore rupees. So this is a company which had never made ventilators, and yet it was getting bulk orders from the government. We followed up this story in June 2021. Several months had gone by. And by this time, the ventilators were in hospitals. And we found that most hospitals were complaining that these ventilators were not working. Again, just to make the point that follow-ups are quite important when we're looking at questions of public accountability and we're probing transparency. I think the next step is establishing that lack of transparency often results in lack of effectiveness. To sum up, I'd like to say that we have a range of instruments available to us as investigative journalists. If we may just go on to the next slide, I put down some of the instruments that we can use. I'm a huge advocate of looking up publicly available information. I feel oftentimes we don't do that enough. In India, governments are legally bound to putting up tender documents online. There's a lot of information that the government shares. In Parliament, when questions are asked, there's a lot of information that you can find on ministry websites, which is often not presented in the most easily accessible manner. It means you have to clean up the data, and there's a lot of work to do, but that is information sitting right there. But of course, we have to move beyond publicly available information. In India, we're lucky to have a right to information law. I guess other countries have similar legal instruments. It's important, of course, as always, to understand the economics and to cultivate sources both in industry as well as among officials, and also for publicly listed companies, there's always the option of looking up their statutory filings. Some of these instruments, and we continue to look for more, but while we do that, we must not lose sight of the fact that every great piece of investigative journalism started with someone asking the right question. And therefore, I think thinking about the questions that we ask is as important as looking at ways of answering them. Thank you, Deepak. I'd like to hand
Thank you, Supriya. Thank you, Supriya, so much for this wonderful presentation. In the last slide, you said, I mean, as a reporter, we all know, you said that look for sources in market, the rivals. So can you explain this a little bit? Because whatever is there in public domain, we get it through RTI, through parliament discussions and kind of thing. But getting things from, because say there was a case in central India, I remember during COVID thing, that there was a company who was manufacturing this spirit, which was used for sanitization. So that was not up to mark. But that story was broken by a Hindi newspaper, and later on it was covered widely and action was also taken. So, and I think that it was the info which journalists they got from. So, I mean, can you please elaborate on this?
Absolutely. Deepakji, one of the examples that I cited was the PPE orders, and the fact that not only were the orders delayed, but the orders actually went to firms that were not even part of industry associations. And actually the genesis of that story was talking to the manufacturers, because it's the manufacturers who helped us understand what had happened. They shared with us the meeting that they had had with the government, and that became the starting point for us to dig deeper. And also actually when it came to investigating oxygen plants, there again, the tender document that we pulled out listed 3 vendors, and we got in touch with the vendors, and we realized that one of those 3 vendors actually had not delivered at all and had been blacklisted like 2 days before we had started investigating the story. And that's also something we discovered while talking to other companies. So, talking to companies, since they're also dealing with this lack of transparency, and they're kind of hugely bothered by it. And, they always have insights to share. And I think for COVID, it's proved to be a very important source of information for us, which is like always looking up who are the players in a particular sector. I think the vaccine story, which I've not had the time to talk about, again, it's been very important to talk to vaccine makers in India. And actually the vaccine story that we see in India has like global implications, and therefore talking to companies when it comes to investigating purchases is critical.
Yeah, thank you so much, Supriya. We know that ultimately for investigative journalists, despite this digital age, the conventional journalism tricks, reporting tricks, they still play a big role. So we have Rajneesh Bhandari. Rajneesh is from Nepal. the Himalayan country, and Nepal is the place where India is closely associated, by language, by culture, and so many things. Nepal has also seen worst COVID effect. And being there as chief of NIMJN, Rajneesh is doing so many things. So Rajneesh, floor is yours. Welcome.
Thank you, Deepakji, for the introduction. I need to give you a little bit of background about NIMJN to our friends in India, and also to other journalists who are joining all around the world. So it's a new non-profit. We actually started during the pandemic, and so we specialize in investigative reporting and multimedia storytelling. So at first, our focus was on journalist safety, and we did some trainings, during the pandemic. Also, some little bit of collaboration with, other health officials, especially for journalist safety, and a little bit on health counseling and other things. But as you know, we are journalists, and we can't just be stopped by student trainings and other things. So we started this collaborative investigative reporting on COVID-19. So 23 journalists, they teamed up in 10 different teams. So the unique thing about this is the journalists are actually working on different media outlets in Nepal. So the thing about competition that I used to feel when I was working in a local television outlet out here, it's a lot of competition, but we broke that competition thing when we started to collaborate to investigate on COVID-19. So I think that's a unique part of it. So we actually went to a report on expenditure during the COVID-19, on crime during COVID-19, poverty, and some other issues. So this journalist, working with different media outlets, worked together to investigate on COVID-19. So one story I would like to share as a case is on especially about the transparency and accountability of the expenditure during COVID-19 at the local level. So Durga Dulal and Kalpana Bhatrai, they started looking at this story. So we filed right to information at 10 different municipalities. Only 2 responded, and those 2 also didn't clearly said about the expenditure. Even they replied to our RTI request, they did not give clear information on how much was expended, and also on different categories. So after 4 months of waiting, we again went to request the same information in those 10 different municipalities, and we also went to the Information Commission. But as you know, this is pandemic, and everyone is working from home, so they took this as a kind of as an advantage, or as a something they took it as an advantage of not addressing it, and our request was not cited. And the interesting thing is our request was lost in between. We couldn't find the file, so we are still working to working with finding other requests at the Information Commission in Nepal. So the finding of our story is there is lack of transparency on the local level expenditure related with corona epidemic management, especially in the local level, and the expenditure, what they are saying and what they are informing is also not realistic. They're saying that they spend so much money, but when we ask other political leaders or people who are also auditing it, we also talk with the auditors who are auditing it. They are saying that it's not realistic. So this has been the case of one of the story which we investigated during the pandemic. Other issues which we also looked were about especially how did the government go wrong during the COVID-19 pandemic? Especially there's a lot of demand on certain things, but the government is actually spending on other things. So there is not a great relation on the need and on the demand and on the expenditure. So that was one thing we highlighted. Also, when there is especially about laws and practices in place, but people from Dalits and other minority groups were facing injustices to extreme labor during the pandemic, and also regarding other story was about donor dependent. The government gives patients at mercy of unchecked machines. Though Nepal is getting different support and other things, these machines are not checked properly and they are being used. So one example is that so Nepal got some support of ventilators. In the name of ventilators, when it actually reached the rural area, so it's actually not a ventilator. It's not actually a proper ventilator that would be used. It's simply so these issues will highlight it, and also the impact of COVID-19 on people below poverty level, its impact on mental health and challenges. So one thing I want to share is while working with reporters in Nepal from different media outlets and collaborating on these issues, there are some of the lessons that we have learned. So one thing is collaborative reporting is not as hard as we thought. We thought that journalists from different media outlets would compete, and they would try to break the story first. So they published the story together, they collaborated it, and they also credited the reporter who's working in different outlets. So I think that's really an important thing that we learned is even the journalist working with different outlet, he got equal credit with other outlets. So that is one thing. Another is regular updates were vital. So we did weekly meetings with journalists. We were working on this. Safety during the pandemic was very important. So we made sure that journalists were following safety protocols and precautions, not only for themselves, but also for the sources that were intervening. Digital tools are important. So we used a lot of digital tools like Facebook, Skype and others, tools that are available to interview people, to investigate on these issues. And we also went to the field when it was necessary. Another thing is investigative reporting takes time. Like the story I mentioned about finding RTI, and we're still working on that. After 8 months, we're still working. We published the first part of the story, and we are still working on the second part of the story.
Rajneesh, I'm sorry to interrupt you. Can you speak a little slow, because we are continuously translating this. So interpreters, they need, so please.
Sure.
Yeah, thank you.
Sure. Yeah, and the other thing is we also, the field visits are important. Though this was pandemic and we were very limited to, reporting from the field. Field visits are very important to describe, to make scenarios, to also as we work on multimedia as well. Field visits are really important. Other thing is multimedia tools are useful in telling stories, whether it's freely available tools, it's just a video or a picture or a data or maps or something, that could add something to the story. So these tools, multimedia tools are important, and mentoring helps. What we have seen is what we have talked with the journalists working, in this reporting initiative is mentoring really helped them to continue the story. We are still working on after 8 months, we're still working and finding RTI, and we're very keen to pursue the story. And I think it's only possible because of mentorship. And fact-checking is important because during the pandemic, we have seen a lot of misinformation, disinformation, and malinformation, during the pandemic. So fact-checking is really important for investigative reporting. Yeah, Dibakshi.
Yeah, so you are done, Rajneesh?
Yeah.
Yeah, thank you so much. So you raised this very good point about collaboration. And collaboration, of course, this is very important in journalism, like other fields also. And when it comes to two countries, this is much more important. But in a country like India, where we have so many states, even here, collaboration among journalists of various states like some journalist, he is there in Tamil Nadu or in Andhra Pradesh or say in Assam or in Gujarat, or somebody who is in Madhya Pradesh or Uttar Pradesh. So these are culturally so different states. So you raised a very good point about collaborating, that journalists should come together. I mean, instead of being rivals, instead of competing for information, something new could be done. And Rajneesh, like you are also an expert of multimedia. So can you please tell, how this multimedia, because with technology and digital technology and all these things, how this can be used in reporting of this particular COVID purchases? And
thank you, Deepak. I would like to go with the first question on collaboration. So when we collaborated, we are collaborating with journalists from all 7 provinces in Nepal. So it was not just, collaboration with journalists in Kathmandu, the capital. We were collaborating with journalists from, all different, all different provinces. At the same time, journalists working with different media outlets. So it was really a challenge because, how to collaborate with journalists while working with different outlets, right? So we made a kind of like certain standards, certain values, and certain norms, which we adhered, and we also wanted journalists to follow them. One about like honesty, about trust, about like keeping the deadline, keeping publishing on the same date, giving equal credit line to the reporters, and it worked. And so I'm very happy that it worked, and like they were also publishing in different outlets with which we're competing. And why we need collaboration, especially investigating COVID-19, is for the impact, because we want to create impact and also tell the audience, the readers, because we care about the people, and we want to make sure that their voices, their stories are told in majority of the media, and it's addressed, right? So we also want impact, and to bring impact, I think collaboration is really important. So I want to go to the second question that you asked about using multimedia tools in telling stories. As we are in the to 2022, and we are moving so rapidly with mobile revolutions, with artificial intelligence, with data journalism, with censored journalism, everything happening around the world. So if we don't use multimedia tools to tell our stories, we won't be doing justice to our audience. If we are not telling especially investigative stories, if we are not using multimedia tools, we will not be doing justice to the audience, also to the story, because multimedia storytelling will bring more engagement to the stories. It will help to reach out to more audience. At the same time, it will also bring like engagement and some sort of like dialogue or discussion on the story. So I think like multimedia tools, especially you could use any tools. Like if you're working on text stories, you can use data for pictures, for videos, for 360 videos, or any other tools you could use to tell the stories better.
Yeah, thank you, Rajneesh. Thank you so much. Now we have our last speaker, but not the least speaker, Chrissy Giles. She is a star reporter in health sector. She is global editor at Bureau of Investigative Journalism, UK. So Chrissy, please go ahead. Welcome.
Thank you so much. Thanks everyone for the invitation to be here. I think I'm having some help with my slides, so if we could get those up, I would be really grateful. I'm really excited to hear about the collaboration, because the way we work at the Bureau is that we are a non-profit newsroom, and we produce our own investigations that go on our own website, but actually we get the most impact by partnering with other journalists from all around the world. Like Rajneesh said, making sure people have credit when they've worked with us. And then we partner with newspapers and TV and radio in the UK, in Europe, in Africa, in Asia, and in South America. So I really hope we all might be able to work together as well after this. So I'm going to talk about 3 different investigations we've looked at, which is a few things we've been doing in the 2 years that our team has been running. So if we could have the next slide, please. Thank you. So we were interested, like many investigative journalists, in looking at COVID, because we understand that in the world already, it's very unfair and unequal access to healthcare for many people. And unfortunately, with something like the coronavirus, these inherent unfairnesses have been accentuated. So we were interested in looking at supply chains and procurement processes for everything from COVID vaccines to treatments to other medicines. And we understand that in a lot of cases, these are hidden from public scrutiny, and often that's to protect the business interests of the corporations involved. And they will say, oh, it's commercial, private information. But unless we have transparency between the companies and the governments, we don't know things like if these drugs are running low and what happens if there is a shortage. So as Supriya Ji said already, when there was a shortage or potential shortage of oxygen or PPE, that can very quickly turn into a major emergency. But if the general public doesn't understand what's available and what's in short supply, then there's very little we can do. And obviously, problems at any stage of this supply chain can lead to patients not getting treatments that they need. And these are potentially life-saving treatments. Next slide, please. So the three stories I want to talk about are, very briefly, we looked at the supply chain for a drug called propofol. We looked at the pricing around medical oxygen, and we looked a little into contracts around COVID vaccines. Next slide, please. So propofol is a sedative that's used for patients in critical care, and it became apparent early in the pandemic that it was unfortunately in short supply, at least in Europe. This is a drug you need if you're going to be ventilated or if you're going to be in intensive care, so it's very important that we have it. You might know it as Diprovan or Celofol, there's various generic names for it. We were interested in looking into propofol specifically because we know it's a difficult drug to make. So not many companies want to make it. It's expensive, it's tricky to make, and so there's very little economic reason for many companies to be involved. So we suspected it could be a very difficult drug to get if suddenly everybody in the world needs it and you can't just turn up the machine and make more of it fast. So what we wanted to understand is, what does the supply chain look like? And there wasn't very much information out there. So we looked, as Supriya Ji said, at public information, but we've also looked at private information that we had to pay for, academic information, and also obviously, like we've all talked about, interviews with experts and sources. So just to run through for the supply chain story, we wanted to find out who was making the raw ingredients, the active ingredients, and the final product. Where in the world are they? Where is the medicine moving to and from? And where are the points where it could become really tight if the demand goes up? So publicly available information that we looked at included that from drug regulators. So in the USA and in New Zealand, the drug regulators were keeping a list of the different drugs and the amounts that were coming in and out. We also spoke to people with expertise in supply chains. We worked with a group called CIDRAP, as you can see, they're here from the University of Minnesota. And we looked at PubMed, which is an open source database for medical and biological sciences, academic papers. So we searched on there for information about supply chains and about propofol. We also paid for some information. So for shipping records, we wanted to be able to see where the propofol was traveling to and from. We looked at something called Panjiva, which you have to pay for, but it basically allows you to look at shipping information. And we also worked with a company called IQVIA, and they have lots of information on drug markets. They're incredibly knowledgeable, but unfortunately it's quite expensive. So we tried to get them to help us because we're not for profit. And last but absolutely not least, we had lots of interviews with experts and industry insiders from different stages of the supply chain. So we knew that China and India were very important in creating the raw ingredients. So we made sure we had freelancers in these countries working with us to find sources there. And we also spoke to people from the United States and from Europe with expertise in importing and exporting drugs. Next slide, please. So what we basically found out, and you can see the illustration here from our story, is that just 5 pharmaceutical companies make propofol that goes to the USA. So that shows there could very quickly be a bottleneck. And what was very scary is that all of these companies carry out the final stages in Europe or Asia. So if something catastrophic happened in those areas, for example, COVID, and the factory workers couldn't go to work anymore, very quickly the supply chain would be shot. we found that lots of those companies also used the same specific company in Italy. And basically the experts told us that depending on a few overseas companies, as you'd expect, makes this a very precarious process. Next slide, please. Now, I won't take too long on the rest of these, but you get the idea. We were looking now at medical oxygen. So again, it was about a supply chain for oxygen. As Supriya Ji has mentioned already, you can get these things called PSA plants where hospitals can generate their own oxygen. So we were interested in looking at these plants in hospitals, but also liquid oxygen. So in many developed countries or high income countries, you would have big trucks that would bring in liquid oxygen, and that's purer and it's also a bit more of a reliable system. In many other parts of the world, you're relying on these plants. So we spoke to, as you can see on this slide, experts from all kinds of places. So from non-governmental organizations and charities that work in oxygen, to people that sell the oxygen, to people that used to work for these big gas companies, and people that have experience either as hospital staff members or patients or relatives. Next slide, please. What we found out by doing this, as we've seen the shortages, we actually found during COVID, the large multinational gas companies that were often headquartered in Europe were actually spreading misinformation about these plants. They were telling people in South America and in Africa that these plants that you might build could actually kill your patients. And obviously that's totally incorrect and extremely irresponsible in my opinion. We also looked at the prices of cylinders and found that across different countries in Africa, you could pay anything from $20 to $112 for one of these large oxygen cylinders. And that shows that there was no consistent way of pricing and obviously put lots of people at risk of having to pay more for their healthcare. We also found that companies were adding fees on top for transport and cleaning. Next slide, please. And last but not least, we looked at COVID contracts. Now, many people have looked at COVID contracts and they're very important. We wanted to find out details of contracts, details of the negotiations, how much was a government being asked to pay for each dose, and what were they being asked by the companies to put up as indemnity in case something went wrong. So luckily, because lots of people were working on contracts, we could find them. So some ministers in Europe were actually leaking the contracts on Facebook and social media. Other investigative outlets, as Supriya Ji has mentioned, were also looking at this, and organizations such as Open Contracting, they're very good, were getting these things. We also had sources that we spoke to confidentially who could give us these details as long as we agreed not to mention their name or their country's name. And also there are many academics looking at vaccine deals such as Duke and other organizations in the world. Next slide, please. So what we found, one of the most shocking things was that Pfizer had essentially been accused of bullying lots of governments in Latin America. And what they'd said is if something goes very wrong with the vaccines, we won't cover it. We want you to cover the costs. And to be able to cover the costs, you should be able to put up your military bases and your sovereign assets, which was actually very shocking and isn't what they'd agreed with many other countries in the world. And as you can imagine, this led to delays in signing in some countries. And by the time we published in Argentina and Brazil, there actually hadn't been an agreement made with Pfizer. I think there subsequently has. Next slide, please. So just to wrap up, so we've got time for questions. As everybody else has mentioned, investigative journalism really doesn't matter unless it changes the world for the better. And here are a few impacts that our work has helped contribute to. So the work on oxygen meant that one of these large companies, Air Liquide, had actually joined a coalition. So now you had the big company at the table with the charities and WHO and Unitaid, so they could be part of the conversation. And that led to $90 million of funding being made available, as you can see on this second point. So it's led to real change, and we were happy to be just a small part of that. After our contract story about South America, we found that South Africa had refused to sign a contract with Pfizer with the same agreements about putting up their sovereign assets. So again, we hope that we helped contribute a little to that. And last but not least, we saw lots of our investigations being picked up in many different countries in different newspapers and TV. They were translated and put into all kinds of formats for all kinds of people, and we won some awards. And that's not important to win awards, but it does show that people outside of the field are recognizing the importance of investigative journalism. I think my last slide is just some links, so we can skip that one, and then just my contact details are on the last one. Thank you so much for listening, and I'm excited to answer any questions.
Thank you so much, Chrissy. It was really wonderful hearing you, and especially about the multinationals, the way they are bullying the governments and the way they have formed the cartel. And so this leads to another question. I mean, post-COVID, there were many allegations that medicines, they were unnecessarily given to people. And at a time, there was no requirement of that particular thing, but still government, they bought it. So this is also a one angle to it. So if say if any government got these unnecessary medicine, any health system, any health department, I mean, what is, how do you investigate that? How do you know that this was not required and actually it was bought and this was forcibly given to patients? And there are so many drugs which we remember during last 2 years that finally it was said that they were actually not required, the kind of don't want to name them. So how do you investigate such things?
I think there are several ways. I think one thing that COVID has shown, especially in the UK, is that we weren't planning, we weren't prepared for such a big outbreak, a pandemic. And although the government had papers saying we're prepared, we've looked at flu and what we would do, in reality, we weren't ready. So as Supriya Ji said, everyone was scrambling for PPE, or they were scrambling for this and scrambling for that. And I think it's natural for governments maybe to buy something on the assumption it might be needed. But I think what it's more about saying, why weren't we ready? And once these things start, why can't we look at evidence? So how is the government using evidence? So then you could use things like RTIs or FOIs, as we call them in the UK. Maybe you could ask for, if there's a specific drug that you're interested in, you could do an RTI and ask for conversations and documents around that drug. You could also investigate, where did those drugs come from and who did the deals? And might there be a reason someone in government wanted to buy a big pile of those drugs? Maybe they have financial interests that they haven't disclosed in it, or maybe there's a family contact. So we saw that in some cases in the UK, people pivoted their businesses to create alcohol hand gels or PPE or other equipment. And then you look a little bit deeper and you're like, oh, your brother-in-law is actually a minister. So again, I think it's following the money. So trying to work out, why would somebody be pushing for a particular agenda or ignoring something that we think they shouldn't be? I think it's right to say there is so much to look into in COVID, and hopefully once it's much less of a pressing health issue, I think us investigative journalists are going to have a lot to rake over to try and learn lessons for next time and to hold governments to account.
Yeah, thank you so much, Chrissy. Thank you so much. We have got so many questions in our Q&A box. So we'll try to take them one by one, because we have just 12-15 minutes left. So for first question, and I think I will ask Chrissy you to answer this, because this relates to India. So Supriya, we know, so this is about like the variation in the cost of COVID vaccines. At some places, the same vaccine was selling for X amount. In some other place, it was selling for Y amount. So this had happened. So why this had happened, and what is behind this, and how you get to know about that, because these pharma companies, they had their own excuses to say that we are selling this vaccine because we have added this particular thing to it, kind of thing. So what do you have to say on this?
Would you like me to answer, Supriya Ji?
Yeah.
Sorry, okay. I think the vaccine pricing is very, very interesting. We've actually just done an investigation looking at how some of the richer countries in the OECD, so the economic area, are actually using COVID vaccines that they've donated to write off other overseas aid. So they're actually getting paid more than they paid. They're getting refunded for COVID vaccines that they've given away, even if they haven't been given to people. So there is so much to dig into this. And I think understanding pricing, even across the European Union, which the UK is no longer part of, but even within the EU, different countries have paid different amounts, and it's almost impossible to find that out. Governments are very tight-lipped. The pharmaceutical companies don't want you to know, and nor do the governments. So again, I think it's a lot of good investigative work, which is talking to sources, trying to speak to people who have worked with ministers. Maybe when there's a change of government, people might want to share information, ministries of health. So it's all that good stuff of basically generating contacts, keeping in touch with them, working your sources and trying to make them feel that they can talk to you confidentially and that you might be able to squeeze some information out of them that way. I think otherwise it's very, very tricky. I think trying to look at what companies are doing to the vaccines and how they differ. I mean, it's hard. I think it's a massively tricky issue. I think then you've also got the idea of somewhere like COVAX, which is the global system to try and get vaccines to every part of the world. It's shown how hard that is, and now other nations and regions are setting up their own ways of distributing vaccines. So I think the pricing is complex, but the pricing is just one very small part of the puzzle, which is which vaccines to whom, by when. So yeah, it's not much of an answer, I'm afraid. I'm just agreeing it's very difficult, and there's definitely investigative tools we could apply, but there's no quick way of finding this out. I think it's just keeping on asking the right questions.
All right, thank you so much. And asking the right questions, that is something which we all investigative journalists and any journalist should treasure. So this question has come from Mr. Lal Bahadur, and this question I want to forward towards Supriya. So Supriya, I mean, this is more related to investigative journalists. He says that we have stories, but now with all the platforms are drying up where we can actually publish our stories. And the related question with one other journalist, he said that when journalism is becoming so difficult, investigative journalism is like committing suicide. So what you have to say on this, because it's really tough, and especially when you are reporting on COVID, because I mean both ways, because if you go on the field report on COVID when it was on its high, you are actually medically you are exposed, and otherwise also. So these two related questions. The second one is from Ashish Chokse.
Thank you so much for these questions. And I'm not sure what to say. It is you're quite right in saying that journalism in India is quite embattled at this point. Sort of discovering daily news itself is challenging, and going further than that and investigating stories. A whole host of things that we need to tackle, which is, of course, like investigative journalism is extremely time consuming. It means sometimes you dig and then you find gold, but oftentimes you also hit a wall. And for small newsrooms like ours, dedicating resources to that is something that we're very committed to doing, but at all points it's a tightrope balance. But we're kind of aware of what was mentioned, that there are very few news organizations in India that are now willing to challenge the official narrative. They're very, we know that large sections of the mainstream media in India have, turned even propagandist. However, I would think that COVID actually opened up the possibility for even, large mainstream organizations that wouldn't otherwise want to question the government or hold power to account, purely because the second wave in India was so deadly and people were like really dying like flies. At some point, I mean, the largest Hindi newspaper, one of the largest Hindi newspapers in the country, Dainik Bhaskar, also turned to doing these sort of hard-hitting investigations. So I think that especially when it comes to health, something that hits people very directly, it opens up possibilities for investigative journalism. However, like all the constraints remain, which is how do you fund investigative journalism? And there I would say readers who value investigative journalism, who understand the importance of the work that investigative journalists do in holding power to account, I guess especially because I work in a digital news organization where we remind our readers that if they value the work we do, they should contribute to our reporting fund. They should subscribe to story.in, because that's actually the only way to keep this financially viable.
Yeah, you are right. And there are so many questions. Everybody is asking government or the organizations, they don't want to answer your queries. What is the way out? So we in India, we know we have RTI, file again, go to next level, next level, next level. And then ultimately the good thing about India is that ultimately the information comes. Even if it is late, the information is in public domain, which is good about India. So Rajneesh, speaking about Nepal, I mean, how transparent and how much information journalists they normally get? Because participants, they would like to know the situation in Nepal, investigative journalists, when they file RTIs, if you have one. So how much information is shared?
Thank you, Deepak, for the question. Especially like by laws, like in documents, like it's said, like the information should be in public domain. But in practice, it's very difficult to get, like, because we have been trying with different municipalities to get the the COVID-related expenditure on in different categories, like how much is spent on what categories. So it's not publicly shared. Like they have a bulk information, but bulk information does not verify like exact spending or like how much is spent in what thing. So it's not easily justifiable. So these informations are like very difficult to get as well, and there are like especially on procurements and other things, that there are like commissions and they investigate, and even after they investigate, the reports are not published. So that's another challenge for journalist reporting in Nepal, and I think it's a similar scenarios in in South Asia maybe. So especially in Nepal, like there are investigations, they do investigations, but they're not published. They're not known to people. So that has been very critical in doing investigative stories out here.
You are right, and same question, almost the same question and suggestion came from Manoj Varghese. He also said that doing investigative stories is one thing, and then getting them published is another. Finding platforms, but again, there are platforms also, and we have one speaker on this very discussion. So one more question is, this question is particularly for Krishi, and this directed towards Krishi. And the gentleman is Professor Divakar Shukla. He is head of the Department of Journalism School. And he says, for a budding journalist or a journalism student, what is the most critical aspect to work on, prepare as they embark on a story?
Oh, that's a big question. What's the most important thing? So I think
we still have 8-10 minutes. Yeah.
Okay, great. Might need a bit longer. So I think in terms of all good journalism is about, we said before, curiosity and asking the right questions. I think for investigations, and for investigations at the bureau where I work, what we need to know is that we're trying to uncover something new. And like Supriya said, it doesn't mean it's definitely hidden. It could be out in plain sight, but we need to uncover something new that we think is going to help answer questions for us that are systemic. So we want a story that's affecting many people in many different places. So I think the best thing someone can do is to have a clear hypothesis for their story. So know what they're trying to find out. Now that doesn't mean you're going to go out and just find things to prove it. So we had a hypothesis that propofol is prone to bottlenecks and shortages because it's expensive and hard to make, and that during COVID it could run out. So our hypothesis was that it's going to be a small supply chain with like a few suppliers and a few people that manufacture properly and a few people that deliver it. And it turned out that was true, so then we could publish a story. Sometimes you'll have a hypothesis that you can't prove, and then you have to stop the story. So I think it's about asking the right questions, but following what the data tells you, not just trying to find things that suit your argument. So it's having an open mind.
Yeah. Thank you so much, Chrissy. And the similar question was from Dr. Archana Bharti. She asked, what are the things which one should keep in mind while doing investigative journalism? I think the kind of questions are coming for investigative journalism. We must have a webinar on about investigative journalism in particular. Sarman Nagele, he is asking, and this question I'm directing to you, Supriya. This is about how can one know how much money Government of India has given to various states. How do you know this? How do you investigate this?
So again, the Government of India makes various, it disperses funds to states under various heads. Some of it is, you can find it through budget documents, and there's kind of, expenditure directed through the centrally sponsored schemes, where there's lots of schemes where the center allocates a part of the funding. Implementation is done by the states. So this information, either one can go through budgetary documents or documents on the websites of particular ministries. And if you're not able to find it, then you can file RTIs. This should be relatively, I would say, easier to access. What actually proved to be the most difficult thing to investigate during COVID was actually the money that was coming to the central government through the Prime Minister's, the PM Cares Fund, where the Prime Minister himself, like publicly, he just asked everyone to make donations to the central government, and that fund is outside the ambit of RTI. So there we as journalists hit a block. But when it comes to central funding that is made to states, sometimes it's scattered and it takes work, but those documents are available in the public domain.
Thank you. And one question is from Ram Yadav. And Ram, if you have been listening to our webinar, we have tried to answer all these questions, but still, if Supriya, she wants to answer, I'm reading this question. What could be the tools and methods of doing investigative reporting on COVID and other health-related issues in India? Also, how does one approach the information available in the public domain to carry out investigating reporting?
Thank you. I guess Chrissy also spoke about this at length. What are the tools that we can use? And some of the tools that Chrissy spoke about are quite universal, and we can pretty much use them in India as well. I mentioned them too. One is, of course, looking at publicly available information, finding out which government agency is placing orders, going to its website, pulling out the tender documents, examining those, and other sources of information, responses made by the government in Parliament. But like the crucial thing here is that we can't stop short of just reporting the information that the government is putting out. Our main task is using these sources to basically get information or to know the claims that the government is making. And then our role as investigative journalists is to verify those claims. So to give an example, as I mentioned, that the government said that it had sanctioned funds for setting up, these PSA oxygen plants. Now, what we did was to basically call up the hospitals and ask them whether those plants were working. And in several stories, it means a reporter needs to actually physically go to a place to verify a claim that the government is making about its expenditure. So that's kind of like the field reporting aspect of it, just like traditional shoe leather journalism. Deepak ji, as you mentioned, like investigative journalism is actually, in that sense, it sounds esoteric, it sounds like complex, but it's actually drawing upon the tools that like journalists across the board use. It's just that on top of it, you sort of kind of add on more skills, like looking at big data sets. Again, like all good journalism, very important to cultivate sources, to stay in touch with them, to probe a story from all possible angles, to essentially think of every single person who would know something about that topic and calling them. So that's essentially what I guess investigative journalism entails.
Thank you. Sarmanjan Nagele had one more question, but I think his question is well answered in one of our story where we said how much World Bank is giving money to your country. So World Bank data, the way World Bank gave money to countries to fight COVID, that is there. So maybe you can go to our resource center, our website, it is there. Vaibhav Palnitkar, he is saying that you said about tools, and you said that you have to reach to reach to the place where this question has come up. But he's asking what practices one should adopt to, which should become kind of SOP for our investigative journalists.
Would you like me to answer that, Deepakji?
Yeah, I think if you can answer, because this is more this question.
I'll just be brief here that it is important, I think, for investigative journalists to at all times be aware of the ethics of investigative journalism, which is that we will never misrepresent ourselves to anyone. And when we go out in the field, we will never, we don't believe in sting operations. We don't believe in any form of entrapment. And the idea is to go to a place and to identify ourselves clearly, and to ask the questions that need to be asked. And that often sometimes kind of you feel that if you were to adopt other methods, it's going to kind of convincingly establish a fact, but it always puts, then it casts investigative journalism in doubt. Like for the readers, building trust with your audience is as important as doing good work. And I think that involves being ethical at all times. So all the tools that we use, we make sure that we're always aware of the ethics of it.
Yes, one journalist, he sent a question, rather a comment. He's saying investigative journalism in itself is a very difficult thing. We have seen so many examples. How can investigative journalists, they can keep themselves safe? So Shivam, I'll request you to please go to our website, www.gijn.org. You'll find number of resources in English and Hindi about how a journalist, he should keep himself safe from digital attacks, trolling, and so many other things. There are so many resources which are there available on our website and at our resource center. So I think we have just 1 minute left. So I think I'll take this opportunity to thank you all, because it was a wonderful webinar, wonderful discussion, and we are glad, we are privileged to have such a wonderful panel here today. And so many journalists, they attended and they questioned. We have got so many questions, but we don't have enough time now. So once again, I thank everybody. Thank you, Chrissy. Thank you so much for joining our webinar. Thank you, Rajneesh, for joining and taking out time. And Supriya, thank you so much for being part of this. And I'll request all our participants that they visit our website, www.gijn.org. If you want to read things in Hindi, they are in Hindi. If you want to read in Bangla, they are in Bangla. If you want to read in Urdu, they are in Urdu. If you want to read in so many languages, they are there. So once again, I thank everybody for patiently being part of this webinar, and see you next time. So thank you so much. Thank you.